in that session, we talked about all-cause mortality and sudden unexpected death in epilepsy in older adults with epilepsy. As epileptologists, we are familiar with sudden unexpected death in epilepsy, which can happen with people with poorly controlled epilepsy. And we also know that the all-cause mortality is higher in people with epilepsy, but this area remains understudied in older adults with epilepsy. Also, sudden unexpected death in epilepsy is really under-recognized in older adults with epilepsy because their deaths are often attributed to comorbidities or some of the other conditions. So even though the incidence of epilepsy is highest in older people, often we don't attribute their deaths to SUDEP. So I talked about some of the findings that, like, what are the reasons why these are underestimated. There were a multitude of reasons. Firstly, often sudden unexpected death in epilepsy, mostly these cases are analyzed by forensic pathologists and maybe general neurologists who would not always consider seizure as a possible etiology or cause of death. And they would typically think that one of the other comorbidities may be more likely because, cardiovascular issues are more common in older adults. So they're more likely going to look for other causes. So epilepsy would not even be mentioned as a potential cause of death in many autopsy reports. When epileptologists were involved in some of these studies, they found a much higher rate of SUDEP compared to which was being reported by a multidisciplinary committee when epileptologists were not involved. Seizure history was often not obtained in many of these patients. Again, because older adults have so many other comorbidities, it's assumed that one of those is causing this. Seizures may not be considered as an immediate cause of death, may not be considered as a proximate cause of death. And if they have some sort of arrhythmias, then they are more likely to attribute deaths to arrhythmia rather than seizure, even if they don't have any confirmatory evidence of that. So some of the reasons why we have our systematic biases, which make us attribute many of these deaths to other causes rather than epilepsy itself. And much literature which has gone on in the recent past few years, they have looked at the underestimation of mortality due to seizures, and actually found when they have revised, not just looking at the death certificates, if they look at the autopsy reports, their medical records, and look at a more comprehensive view, they're more likely to attribute some of these deaths to epilepsy or sudden unexpected death in epilepsy rather than other causes. Some of the other things we also highlighted, while myocardial infarction in the setting of seizures is uncommon in younger adults, in older adults, it can happen in the setting of seizure. So in those cases, often the death certificates will say myocardial infarction leading to that, which truly was uncontrolled seizure leading to myocardial infarction or status epilepticus, which then led to the mortality in that case. So those are some of the reasons. Then I drew up literature or what some of the most common causes. So the causes for all-cause mortality in older adults with epilepsy are different compared to younger adults with epilepsy. And most of the older adults have their deaths attributed to strokes, cardiovascular conditions, and dementia. So keeping that in mind. And then we discussed about the changing trends of mortality in older adults with epilepsy from a recent paper that showed how in the 1990s, the most common causes of death in people with epilepsy were different, but now as our people with epilepsy continue to age, with the advancement of technology, the causes of death have changed significantly and are mostly now attributed to like I said, cerebrovascular disease, stroke, or vascular dementia, and Alzheimer's dementia. And then I focused a little bit more specifically on mortality in older adults with epilepsy and dementia, which is also one of my areas of research interest. So there are not a lot of publications on that topic. We discussed about a little bit of literature that's out there. And then I discussed my research findings, which basically we did a survival analysis and showed that people with epilepsy were dying with dementia compared to people without epilepsy and dementia, were dying up to 8 years or more younger than people without epilepsy. So just knowing that and knowing that epilepsy should be treated aggressively to get it under control in older adults with epilepsy is very important.